If you're dealing with magnesium deficiency in your muscles or in your brain, you sure as hell want a magnesium that's going to cross the gut-blood barrier. So that's why magnesium glycinate is one of the biggest mineral deficiencies in anyone dealing with chronic pain. Pro-Mag X, I would say if you're in a lot of pain, I would take 2 in the morning, 2 at night. I would do that every day because there's literally like tens of thousands of biochemical reactions that are happening in your body that requires magnesium. What's number one reason why hidden source of pain for you that even your doctor doesn't know about is actually vitamin and nutrient deficiency. Because so many of you suffer from food warring problems and digestion problems. You're not even absorbing proper vitamins and nutrients, or even your supplements for that matter, right? Which is why look at those other points and other videos on how to fix some of those issues with food allergens and with digestion to actually then be able to absorb vitamin and nutrient deficiencies. So which are the top vitamins and nutrients that are causing deficiencies cause problem with pain? Number one, vitamin D. Yeah, many mechanisms vitamin D, and you need vitamin D to actually heal. Vitamin D to me it's not a vitamin, it's a hormone. And there's a vitamin D receptor in every cell of your body. There's a reason why when you look at our autoimmune essentials line, we have vitamin D with the proper kind of vitamin K in there to augment its action. Proper D, proper K together is really important in calming autoimmunity, and it's a huge part of pain. So I can tell you right now is that you can't heal unless you have proper levels of vitamin D. So at least start with 5,000 IUs a day if you're in North America. And that's why it's part of our autoimmune essentials line. The other thing is magnesium. And magnesium, there's so much confusion around it because there's so many different kinds of magnesium. And there's a specific kind of magnesium that's good for pain. And that's Pro-Mag X in our store, which is a form of magnesium called magnesium glycinate. Different forms will, like calcium citrate, magnesium citrate won't even absorb. It'll just go straight through you, which is why that one's good for constipation. Take magnesium citrate because they won't absorb. But if you're dealing with magnesium deficiency in your muscles or in your brain, you sure as hell want a magnesium that's going to cross the gut-blood barrier. So that's why magnesium glycinate is one of the biggest mineral deficiencies in anyone dealing with chronic pain. Pro-Mag X, I would say if you're in a lot of pain, I would take 2 in the morning, 2 at night. I would do that every day because there's literally like tens of thousands of biochemical reactions that are happening in your body that requires magnesium. And yet you can't just test magnesium in the blood and say you're fine. It's very difficult to actually check proper levels of magnesium. And it's very difficult to OD on magnesium because most of it is so poorly absorbed. So if pain is your problem, definitely pick up Pro-Mag X, which is magnesium glycinate in the proper dosage I'm talking about, which is going to be 2 in the morning, 2 at night. If you want my pain protocol, where I actually go through some of the supplements, exact dosages and why, definitely up on top, under the title of this video on YouTube, Facebook, there's a link to download my pain protocol. So go ahead and click that link up there and download my pain protocol. And you can actually see the exact supplements and dosages that I talk about with people in the program.
Carol is wanting to know, is this pain protocol what you specifically use personally?
Hell yes. No, I recommend shit I don't use. No, but I'm just being extremely transparent here. I don't recommend anything I haven't used or experimented or had success in our programs. Huge, big time. So this is the pain protocol that you guys are downloading. It's exactly the pain protocol I used and have figured out, and that we use in our programs. In our programs, that's the exact same pain protocol that I recommend for anyone dealing with pain.
Marionette said, takeaway, that my blood sugar is wreaking havoc on everything else in my body.
Yes, and so is your liver, so your hormones, right? And food. We were just talking about this earlier. You had mentioned Christina's video would be really great. If you guys are interested in seeing some specific journeys of some of our clients and their pain, I would say put in the comment section, message me about pain. Tell us a little bit about what's going on, what's causing your pain. And I bet you we're going to have resources to actually show you somebody else who's actually conquered their pain successfully. So check your message requests. You can message me in the comment section below as well, and we'll get things moving to actually get some resources to you. All right, everybody. Thank you, Mandy, for hosting this with me.